Thanks so much for letting me share some of our kind of preliminary work with you today. So within this presentation, I am going to talk about, I'm going to use the term pet owners, and that's just because of the survey data that we use. They asked whether someone was a pet owner or a non-owner. However, I do want to kind of acknowledge that this reflects that, of course, this is just living with companion animals is another way to use that term, and there's many other terms around that. And so this is just the terminology I'm using based on the limitations of the study data we're working with. And so, yeah, I'm really excited to share some kind of quantitative work that we've been doing, as well as some kind of future directions. So, as kind of part of that background, I think as we all know, around the world, we're facing a demographic shift, especially within countries like, including Canada. We're seeing the rise of the population of older adults. And so this population, those aged 60 or 65 and over, is actually growing rapidly within Canada. It's the group that our population that's growing the quickest. And in order to make sure we don't overburden our healthcare systems, we really need interventions to support healthy aging and aging in place beyond just the medical system. And so the human-animal bond is a potentially important but understudied determinant of health and well-being and healthy aging. And so there is some evidence out there, but it's still limited for some of the different measures of health and well-being, and it's still mixed as well. But in general, when we look at the literature, we can see that pet ownership in older adults has been associated with reduced risk of death, in particular from some certain causes, reduced risk of cardiovascular disease, especially among dog owners, and improved physical and mental health. So as we know, some of those mechanisms that could promote health and well-being, it could be the increased physical activity, especially when we're talking about dog walkers, getting outside, getting fresh air, having to take the dogs for a walk, could hopefully involve some benefits for their physical activity, for cardiovascular health, and cardiovascular disease-related mortality. There's also, of course, the psychosocial benefits as well, beyond just companionship and social support, though. Having a companion animal can actually facilitate increased human-to-human social connections as well. So as I was going through the literature, again, as I mentioned, there's a range of different measures of health, mental health, and well-being that have been looked at in terms of pet ownership and older adults' health and well-being. However, many of these associations, the evidence is either limited, especially in the Canadian context, or the results have been mixed. In some cases, there might even be some negative associations. But again, it's a range of different measures, all the way from physical activity and cardiovascular health. We're talking about physical health and mortality, through to mental health, depression, anxiety, as well as overall well-being in terms of quality of life, sense of community, and social connections. I will say one of the main kind of limitations of a lot of these studies, though, is that they've tended to be cross-sectional in nature. And so as I mentioned a moment ago, they sometimes saw even negative associations in some of these studies. I'll give the example of depression. Sometimes they've seen that pet ownership, there's higher odds of pet ownership amongst those who are depressed. But in a cross-sectional analysis of data, it's impossible to know the direction of that association. So were those in like that particular study who reported being at higher risk of depression, were they more likely to have had the pet first and then develop that depression, or are they more likely to be depressed and then get a pet? And so, especially in older adults, we need more longitudinal analyses to try to get at the direction of some of these relationships. However, when we want to look at these longitudinal associations, it's important that we think also about what kind of confounding variables we might have. And so several studies around the world that I've seen, they've looked at pet owners versus non-owners, and they found that they do actually differ in a number of, potentially very significant ways on a number of different sociodemographic characteristics, but also their kind of current physical and mental health. And so when we do want to look at these longitudinal associations, especially in a Canadian population where we don't have very much information on the differences between pet owners and non-owners, kind of critical first step could be to identify what some of these factors are that owners versus non-owners differ on, so that when we then look at these associations over time, we can control for these. So that's kind of where our preliminary results come in. We have kind of looked at the Canadian Community Health Survey data, the CCHS. They had a healthy aging cohort where they enrolled Canadians more than 45 years of age or older. And we looked at those who agreed to the future linkage of their data. So long term, we'd really like to look at whether living with a companion animal, or in this case, pet ownership versus non-ownership, whether it's associated with lower premature mortality and other health outcomes. But before we get to that, we did want to do a cross-sectional analysis to see, okay, well, how do these people differ at baseline? So, we did logistic regression models, univariable and multivariable ones. I'm only going to present the multivariable ones today just for simplicity. We had a fairly large data set. Missingness was generally low, but we treated any missing data using multiple imputation. And this is a large survey, so we adjusted our models using survey weights and our variance estimates using bootstrapped weights. And then we also thought that sex could potentially have some really important interactions in these associations as well. So we did our analyses also stratified by sex. So getting into like the kind of the interesting stuff, this study and this data set is really, really rich. So it was awesome that we were able to look at a huge range of different measures. So sociodemographic characteristics, for example, sex and age, but we were also able to kind of get into, okay, well, like what kind of home do they live in? Do they own the home? Their location, are they rural, urban, suburban? Also beyond just household income, do they have difficulty meeting basic expenses based on their current household income? Are there kids in the house? Are they retired, etc.? We also will look at some different health behaviors like smoking and alcohol consumption, as well as physical activity. And then we were also able to look at a range of what we called measures of well-being and health. So we did include BMI as a measure, kind of a proxy for health in this case. We also had self-perceived health and mental health, chronic health conditions, how a sense of belonging to their local community, perceived stress, disability status, and also like loneliness and depression. So we had a really good sample size with this. And so one of the trade-offs, unfortunately, is we didn't have a really rich or in-depth measure, unfortunately, of living with companion animals. We really just had the question, do you have a pet or not? But I think one of the major strengths of this study is that we had a large sample size. So we had 24,000 people who agreed to the future linkage of their data, and that includes hospital records and death records in the future. And 43%, when we weighted this, were pet owners. Kind of representative for studies like this in Canada, our participants tended to have a relatively high level of education, be born in Canada, self-identify as white. They also tended to be married or in a common law relationship, not have children in the home, but not yet be completely retired. They also tended to have a fairly good sense of health and mental health at this kind of snapshot in time as well. So here's some of our preliminary results. So as I mentioned, we did look at these in kind of univariable models, and we also looked at them in multivariable ones. So these are in the fully adjusted models, but again, we saw very, very similar results between the two different types. So that's why I'm just sharing these for simplicity's sake. I've bolded over the next slides the factors that were the most significant and that also were like most strongly associated with pet ownership. And so for the sociodemographic characteristics, what popped out in all of our models was age and home type. And I think for us, this, wasn't surprising, but is definitely something that we want to think about further, is the fact that age, especially being in a younger age category versus an older age category, even within these kind of older adults or those who will become older adults by follow-up, that this was so strongly associated with increased odds of pet ownership. And I think this again kind of highlighted to us the fact that there might be some barriers in the older age groups towards still maintaining that pet ownership. And it's something we want to look into further. Also, in terms of home type, I don't think this was a surprise either. The fact, I think that within Canada and probably other countries as well, that it could be more challenging to find an apartment dwelling that will accept some types of companion animals. And it can be more challenging as well to have companion animals in apartments versus detached homes with their own kind of fenced-in yard. I think that is not surprising. And then we also did see some other sociodemographic characteristics that were also significantly associated with either increased or decreased odds of pet ownership, but they weren't as strong. But sex being female was associated with increased odds of pet ownership, as well as having children in the home, not being completely retired, which again is kind of related though to that younger age group, and that's hard to tease out. And interestingly, while total income was not associated, difficulty meeting expenses based on their current income was. And then unsurprisingly, being in a rural area versus an urban, again, I think related to that housing type was also significant. And then decreased odds of pet ownership, again, something maybe to consider in the future. We're going to look into more. Country of birth and race being non-white and being born in a country other than Canada, within Canada was actually associated with decreased odds of pet ownership. In terms of the health behaviors, interestingly, the only one that really stuck out was smoking. And it was actually current smokers versus never smokers were the ones that had increased odds of pet ownership. And this was very strongly the case. And those who were current smokers had much higher odds of being a pet owner compared to a non-owner. And I think this is really interesting and important to consider, not just for our future models, but also when we're thinking about animal welfare and companion animal welfare. The fact that smoking status can also then impact the companion animal's health as well. And maybe this and animal welfare is kind of an avenue we can take, again, when still trying to support harm reduction and decreasing smoking. And then also now when we're going to look in the future at, pet ownership and cardiovascular disease or premature mortality, I think now it's really important to consider that those who are smokers have higher odds of being a pet owner and control for that in our models in the future. In terms of the measures of health and well-being, we did not see as strong of associations with these different measures, but we did see some significant associations. Once again, depression came out, and this is something that I've seen in the literature as well. And I think this is something, very interesting, and we want to explore a bit more in the future as well. But again, we can't tell from this specific analysis that it again is cross-sectional. Is it that those who are more likely to have depression are then more likely to get a pet? Or is it, you have a pet and then you're more likely to get depression? We really can't tell what direction that association is going in. And then we did stratify by sex. And as expected, although the trends were similar for most of the characteristics, there were a few notable exceptions that did differ based on sex. And so it was both in the magnitude of the associations, but then also in a couple examples, the direction of the associations. In terms of the magnitude of the associations, when we stratified by sex, we actually saw that the association between smoking status and pet ownership actually got stronger in the women in the study. As well, the kind of weak association with BMI became significant, but again, just for the females in the study. And those who were obese compared to normal underweight were more likely to have had a pet in this study, which again is interesting for future models looking at health outcomes. In males, the association that became stronger for them was the association with location, living in a rural versus an urban area, and then also the home type, being in a single detached home versus an apartment. In terms of the few examples we had where the direction actually changed for these associations, one of the ones that I found really interesting was marital status. So very interestingly, for those who had an other marital status, being other than married or common law, in women, this was associated with higher odds of pet ownership. So being single or widowed or divorced, higher odds of pet ownership in these older women. Whereas for men, not being married or common law was associated with decreased odds of pet ownership. We also kind of saw the opposite there in terms of being in excellent health versus, poor or fair health, and also the presence of a chronic condition. And then again, the opposite of that, males who had higher mental health compared to like the poor or fair mental health had increased odds of pet ownership. Whereas for females, we saw that higher or kind of better mental health was associated with decreased odds of pet ownership. So these are just kind of a few of the interesting things that we've seen that I just kind of wanted to share with the group. As I mentioned, a strength of this is the really large sample size and the representativeness of the sample for older adults in Canada. So from this, based on the survey weights that they developed, it could represent about 13 million Canadians from the sample. And we were also able to look at a huge range of different characteristics beyond just the typical kind of sociodemographic ones to include additional ones, as well as health behaviors, health and mental health measures, and well-being measures, and also social outcomes as well. And really, we hope that this provides some really important baseline information for future studies that we want to do, looking at now the longitudinal associations between this pet ownership at baseline, controlling for some of these factors, and now looking at health and well-being outcomes well in the future. So this was, again, from kind of like that 2008 time period. Now sufficient follow-up has happened that these, 45-year-olds, 50-year-olds, 6-year-olds, 7-year-olds, et cetera, time has passed that we'll now have enough information on some of these more rare or kind of long-term outcomes, such as mortality and premature mortality and hospitalization from cardiovascular outcomes, that we can look at some really interesting relationships. As I mentioned, though, a major limitation was the lack of information on pet ownership, on companion animals. We don't know really like what kind of pet they had, which is a major limitation. We also don't know, though, about the strength of the human-animal bond, since we do know that that also probably really impacts these associations as well. But hopefully this can kind of provide evidence to support the design of future studies and support them, including more in-depth analyses or more in-depth questions around companion animals in people's lives. So as I mentioned, we did see important differences in pet owners and non-owners. And so in the future, we're going to look at premature mortality as the first one coming up, and then also causes of death. But we thought this could also be relevant for looking at things such as loneliness, also looking at depression, and maybe kind of getting into that direction as well. And then also some of these more social well-being measures as well, such as sense of community and sense of belonging, which are so important to quality of life. And then beyond this, we also want to look at are also the associations between companion animals and health in other critical life stages. So one of the other studies we're looking at now is looking at companion animals and postpartum mental health, especially postpartum depression and stress and chronic stress. And then also, I think this kind of shows the need to kind of look at some of the barriers potentially to companion animals in healthy aging and aging in place, which we want to explore a bit more as well. So thank you so much for letting me share some of our preliminary results, just a little kind of snapshot in what we've done so far. Thank you very much.